Well, finding out that your child, or maybe yourself, maybe you, has ADHD, attention deficit disorder, can be a scary thing. For some, the thought of which medication will actually work can be daunting. So here to talk to us about this very important issue and what you can do before you resort to medication is Claire McMahon-Thomas. She's clinical social worker and marriage and family therapist. Thanks for coming in, Claire, on this Monday morning.
You're so welcome.
So this is interesting. You actually really don't care for the term attention deficit disorder. Why so?
Well, partly it's confusing. And you've got words like deficit and disorder, and the scientists came up with those things, but it's really a difference in how they pay attention. And that difference in focus can actually be a benefit in some situations. And there's three different types, really. There's inattentive, and then there's the hyper, and then there's a combined of the two.
And it doesn't necessarily mean that one has all of them.
No,
right?
It doesn't.
That's interesting.
So the inattentive is kind of ADD, and the hyper is ADHD.
You know, when we talk about the difference, or is there a difference between kids and adults in terms of symptoms? What would you say in regards to that?
The kids, the inattentive, you'll see them having a hard time focusing in class. They may seem to not listen. In your adults, you just move that on to more adult things, like they
not
have
paying bills or something
right,
like that.
or forgetting appointments and things like that. That's the inattentive, whereas the hyper would be more can't sit still, tapping through the meeting. The person is like, please put your pen down. Or someone that's blurting out things when it's not, not appropriate or not time to. And so there are some strategies, though, for people to not take medications.
Let's talk about that. I think that's a big one, especially for parents who have children. Obviously, I'm a parent, so I like to try to avoid all medications if possible. Now, you're not necessarily saying medicine is a bad thing. You're just saying there are some things you can try before resorting.
Absolutely. I think parents do want to try and there's some fears, but the medicine itself is not necessarily harmful to the kid, nor is it addictive or anything like that. In fact, untreated, if you don't use the medicines, you can run into the problem of people being depressed later or trying to self-medicate, because it's a painful disease to keep trying to focus. And the harder they try, the less they can focus.
I see. So what are some of the things that you can do before going the medicine route?
One of the first things is to get them plenty of sleep. Kids, especially young kids, need 10 to 12 hours a night. You check and see do they have large tonsils that are causing sleep apnea, which means they're not sleeping enough. So then they're having ADHD-like symptoms. Also, there's, stay away from the simple carbs and
carbohydrates.
And the sugar.
Really? Wow.
Well, it can increase ADHD type symptoms in all kids and make whatever you have even worse. One of the important things here, we've got to get a 504 plan for school. That's really good. It's not a special ed thing, but it's where you can have a plan with the teacher, hopefully where they understand and agree to limit the busy work. These kids do not like busy work. To limit the homework. If they're doing homework, a tutor can really help. And to give them a little extra time on tests. You got the inattentive type, and they've lost a couple minutes just being entertained.
That's going to help them, give them a better quality of life, at least in the school realm.
Absolutely. And these kids are different, but they're special different. They're not defective different.
Sure. I mean, it's out there. So many children and adults, for that matter, are being diagnosed with ADHD.
Right. The other thing I wanted to toss in real quick is the classroom where you get all the cluster of desks and there's a lot of talking. That's real hard on your ADHD kid. Actually, being off by themselves or in rows where there's no talking is actually more helpful for them.
Sure. Good point. All right, Claire, thank you so much for shedding some light on this.
You're welcome.
Always a pleasure for you to come in. For a recap on this and how to reach Claire, please go to our website, casa.com, and click on Casa Blog. Thanks again.
Thank
All right,
you.
stay right there.